why new novel coronavirus or COVID-19 cases are soaring in South Korea but slowing in China. China is no longer considered the new center of the novel coronavirus outbreak. That title has gone to South Korea, which reported over 500 new cases of the virus on March 4, while China reported only 130 new cases. China has had 80,000 confirmed cases of the novel coronavirus, while 2,981 dying from the disease. However, the rate of the virus spread has slowed in China as more and more patients recover from the disease. In contrast, South Korea is experiencing a rapid increase in novel coronavirus cases and is now the second most infected country in the world. South Korea recorded its first confirmed case of COVID-19 on January 20. By March 4, 5,600 South Koreans had been infected and 32 had died. South Korean officials have been blaming the increase in cases on the Shincheonji Church of Jesus, the biggest and most radical doomsday church in South Korea. Authorities recognize a 61-year-old Shincheonji member as the super spreader that caused the outbreak in Daegu, where 3/4 of South Korea's coronavirus cases were confirmed. The member reportedly interacted with hundreds of other Shincheonji members, leading to a high infection rate within the church. At least 60% of all South Korean coronavirus cases are of Shincheonji Church members. Daegu is South Korea's fourth largest city, and officials are currently testing 200,000 Shincheonji members for the novel coronavirus. South Korea's medical system is also now severely overwhelmed. Vice Health Minister Kim Gang-lip announced that 2,300 people are waiting to be admitted to hospitals and temporary medical facilities. A military hospital with 100 beds will be fitted with 200 more beds by March 5 to accommodate the most serious cases of the disease. South Korean President Moon Jae-in has declared war on COVID-19 and promised to support small businesses affected by the virus. Moon also apologized for the shortage of face masks in the country. He explained that the increase in cases and concern about local infections have increased the demand as well, and it is not possible to import masks. Face masks also started to be sold at high prices once COVID-19 was reported to have hit China. Chinese brokers began purchasing South Korean face masks in bulk and sold them for even higher back in China. South Korea's Ministry of Food and Drug Safety has already advised South Korean face mask manufacturers on their mask exports and supply masks to government-designated sellers. Minister of Finance Hong Nam-ki said that 9 million masks will now be available for domestic sales, and customers are allowed to buy up to 5 face masks each. The number of new daily cases in China has slowed due to their extreme quarantine measures. They put entire cities on lockdown to stop the spread of the virus and built hospitals from scratch. They also implemented travel bans and sent medics to the most infected areas. If they meet specific criteria, the 300 million migrant workers stuck outside Beijing and Hubei province will now not have to face quarantine before entering their cities. Many take this as a sign that China is indeed recovering from the COVID-19 outbreak.